They love you one minute and hate you the next. They seem to cause trouble in all their relationships. And they'll go from sweet and loving to furious and lashing out seemingly overnight. Yep, that's life when a loved one has borderline personality disorder, or BPD for short. Today, I'm going to explain exactly what BPD is. We've heard a lot of things and a lot of untruths, and you don't even know which way is up. And I'm going to explain it all today. And then I'm going to go over the top ways you can help others and yourself when anyone is struggling with BPD. So stay tuned. Welcome back. Welcome back to the podcast. I am your ever-loving host, Dr. Abby Medcalf. I am, as always, so happy to have you here. You know I am happy and excited every time I do the podcast. If you are watching me on YouTube, hello. You're seeing my beautiful, lovely black sweater. Hopefully not a bra. Okay. And if you are watching me there, please, if you like the video, please like it and subscribe on YouTube. It's a great way to, check out the podcast if you like to have a visual along, although it's just me chatting with you. But and otherwise, if you're on Spotify, please rate the podcast there, and Apple Podcasts, please leave a review. It means a lot. I read every review, and it really means a lot. It's a great way to help me, help the podcast reach even more people. We are growing every month. It's very exciting. And, anyway, I love being here with you. And so the more you can support, the better, the longer we can do it. Although we are over 200 episodes, which was a pipe dream a few years ago. So thank you for being here with me. I know you have a lot of ways to spend your time. So I do want to say before we jump in that I take off 4 weeks a year from the podcast. I take off 2 weeks in July in between seasons, and then I take off 2 weeks at the end of December. So when this one drops, I do record these earlier, but when this one drops, it should be somewhere in the beginning of December. So I'm giving you a little heads up that the last 2 weeks there won't be a new episode dropping. We'll come back in January, but I will be back. And in the meantime, there's over 200 episodes. So if you haven't listened to them all, it's a great time to go back in the catalog and listen to an old one. Go on the website. I have all the episodes listed there. So all of them are there if you can't find them on another platform, on Pandora or Spotify or wherever you might be listening. Sometimes they cut them off, they only have 100 episodes at a time. So you can find everything there, and you can also search if there's just a topic. Maybe you're interested in trauma or people pleasing or boundaries or whatever. Just do a search on the website and all the goodies will come popping up, and you can, curate what you're listening or reading if you want to read the blog. So just want to say all that. We all deserve a little time off. It's the way I stay really fresh for the podcast, is taking off those few weeks a year and making sure that I'm giving, great value when I come back. So before we get going on today's topic, because it's big, and thank you for all of you who wrote in and asked about this in various ways, I do want to give two kind of caveats or two warnings or whatever those words are. So I want to say first, don't diagnose people. Do not diagnose your loved ones. If you think someone that you love or know falls into this category of having BPD, then do everything in your power to have them assessed by a trained mental health professional instead of just telling them what they have. I know it seemed like I'm going to give you all the symptoms today and I'm going to talk about it from the standpoint. So you might walk away from the podcast going, oh, I can diagnose someone. You can't, and you shouldn't. I shouldn't even be diagnosing people from afar, and I'm trained. So if I've never met someone and someone's describing their mom or their, one of my clients, it happens a lot. They'll describe their mom or their brother or their husband or whoever, and I'm talking to my client and it sounds like they have BPD, it sounds like maybe that's there, but I'm always very clear with them that I cannot diagnose from afar if I haven't met the person. It's, not what we do. So, and so that's saying that, so if someone you love has definitively had this diagnosis, they have been diagnosed with BPD, I want you to do your best to get consistent professional support for yourself. That is really, those are the two things I just want to say first. Okay. Excuse me. And I have a little cough today. I apologize. I just got over being a little sick. And there's a little something still hanging out. So bear with me and my craggly voice. Okay. So what exactly is a personality disorder? Before we get into what BPD is, I want to really educate you. That is what this podcast is about. It is for smart people who want to actually be educated and not just have a 30-second soundbite about something, and to understand things. So I have talked about personality disorders a little before on the podcast. I've talked about narcissism and gaslighting and some other things. But as always, I want to give you a clear understanding of really what personality disorders are. And then we'll talk about borderline personality disorder very specifically, okay? So, because it'll help you understand what borderline is if you understand what a personality disorder is. And personality disorders are different than mood disorders, which is what we usually talk about. Depression, anxiety, bipolar, we hear about all these mood disorders, right? And we talk about them all the time. But personality disorders at their core are very different. They're about the ways people relate to themselves and other people. That's what a personality disorder is. Well, a mood disorder is really about the patterns that people have in their emotions. I think I said that well, actually. That is the difference. So there are four main defining features of personality disorders. These are the four things we always see, no matter what the personality disorder is. There's some kind of difficulty with emotional regulation. When we say emotional regulation, we mean someone's having trouble with their emotional responses. They maybe get triggered very easily, or they start crying or yelling or get angry or whatever. They have some sort of, the punishment doesn't seem to fit the crime. You ask them to pass the salt and they lose their crap, right? That's poor emotional regulation, right? Or just somebody always gets mad, if you give them feedback. That's poor emotional regulation. You don't always have to get mad because someone's giving you feedback. Okay. So the second thing we see is some sort of distorted thinking pattern, okay? And that, I think, is self-explanatory. They're thinking, they have a lot of illogical premises, a lot of ways that they put things together that don't make sense. So they'll often leap to certain conclusions, and you're like, how did you get there? You're talking about gorillas, and they start talking about ketchup, and you're like, what happened? Wait, how did we get over there? In a personal relationship, that could be distorted thinking about themselves and how they look and their body. It could be distorted thinking. Sometimes they think they have more power than they do in some odd way. And that can be from a very small way to an extreme way. I'll talk more about that. The third thing is they have rocky interpersonal relationships and a lot of kind of interpersonal or relationship problems. We see that a lot. And then the fourth thing is, and it's kind of related to number one, I guess. It's an under or over regulated impulse control. So they either have, so in other words, their impulse control is either crazy, like they have no impulse control, or they have no impulses, it seems like, because there's nothing, they just never do kind of anything. They just are like kind of flat. So you'll see one of those two things. Okay. Now, so when these four kind of qualities combine in different ways, that's how we get a personality disorder. And there are 10 personality disorders identified in the big book that we meaning mental health professionals and doctors, et cetera, use to diagnose people. And I've talked about it before on here. It's called the DSM, and it stands for the Diagnostic and Statistical Manual of Mental Disorders. Doesn't that sound terrible? And you say it, mental disorder, but everything that's in that book, from everything from, from again, any of these mood disorders to a learning disability, anything that's kind of a mental disorder is in this big book. And basically, that we, meaning professionals, go through and go, oh, someone says they're depressed. Well, do they fit the criteria for depression? Just saying you're depressed or thinking they seem depressed, isn't enough. They have to fit a certain criteria, which are outlined in this book. Makes sense, right? For any diagnosis, you have that. And right now, the DSM is in, it's the DSM-5 TR, meaning it's the 5th edition of it. And it's text revision. It's kind of what they do before they go to a DSM-6. They do this TR usually. That's what they sort of do, or they have in the last couple editions. And just to be clear, there's things that show up in the DSM. Homosexuality was in the DSM, I want to say 3. Someone can correct me on that, but I'm pretty sure it wasn't. It was in my lifetime. Sadly, yeah. So, obviously mistakes are made in there. It's all a learning and a progress. We don't have, for example, anything in there right now for, being addicted to video games or something. That's not technically exactly in there like that, but will likely be in a 6th edition. It's always sort of catching up, and the field is very conservative. So, but this is basically the big book we use, right? Whenever we're diagnosing something. So these 10 different personality disorders are grouped in that big book into 3 clusters. And I'm going to just do this very briefly, and we're going to get into it in case some of you are so excited right now, like, ooh, what is that? What is that? And other people are like, get to it, Abby. So, but hey, just hang out. You'll learn. There's a cluster A, B, and C. And basically A is kind of the odd or more eccentric ones, like paranoid personality disorder, schizotypal, we call it schizoid, those kinds of things, right? There's a lot of social awkwardness here, right? And distorted thinking. There's a lot of that distorted thinking. Cluster B is known as and that's where borderline is known as the kind of dramatic, emotional, or erratic cluster. And this one includes borderline personality disorder, narcissistic personality disorder, among some others. And I'm telling you this here because someone with borderline can easily be misdiagnosed as narcissistic because they can seem very similar because they're in this little cluster together, right? So the disorders here in this little cluster B are really dominated by problems with impulse control and emotional regulation. That's what we see. And just because I'll finish it, there is a cluster C that's kind of more known as the anxious or fearful cluster, for lack of a better term. And that's where we have avoidant personality disorder, obsessive personality disorder, dependent personality disorder, other things you've heard me talk about on the podcast. And really, that cluster C is just what dominates it is a high level of anxiety. Okay, so there you go. So now I told you all that so you could really understand where borderline personality disorder fits in. So what are people with this? Like, what is this exactly? And really, people with BPD, they have a very hard time regulating their emotions. And these are the people that feel their emotions more intensely and for longer periods of time than other people. And, I keep knocking things, sorry. So because of this, they have a hard time sort of coming back to normal, so to speak, once they've been triggered by something. Once they're off the rails, it's harder for them to get back in the lane. Than, again, someone who doesn't have that problem and because we all can go off the rails, right? It's possible to go off the rails. The difference is how intensely that's felt, how long that goes on, and how long it takes to come back to some kind of what we call homeostasis or quote unquote normal. So I'm talking about this in the podcast because so many people have written in about it, but I will say that in the U.S., I'm going to talk about other countries in a minute, but in the U.S., the research shows that about 1.6% of adults in the U.S., that's about 4 million people, give or take, have BPD. And about 75% of those are women. I know. And there's definitely been some research more recently suggesting that actually men are equally affected by borderline, but that they're misdiagnosed so often. And usually that's with narcissism, depression, or PTSD. So the PTSD or the depression is really the two, not the narcissism as much, but they'll get misdiagnosed with those, and they don't see that there's actually this more serious diagnosis, or this other diagnosis, because they all can be serious, also lurking about. And you got to remember that you can have a personality disorder and a mood disorder all at the same time. You know, you can have more than one disorder going on. So you can be depressed and be borderline. So, right, you know, you can have these things all together. Okay. Now, and I'm just going to do other countries briefly. I can't do all, you know, this podcast is heard in over, I don't know where we're at now. It's definitely over 170 countries. Thank you. I love you all. So I'm not going to look up, I wasn't going to look up statistics in 170 countries, but I looked up a few for perspective. Canada, not shockingly, is very similar to the US. And with them, it's an estimated 1 to 2% of people, again, mostly women being diagnosed. In Australia, and by the way, Australia, last week we were number 64 in relationships in Australia. I just on, you know, the top 100. So thank you, Australia. It was so cool. I get a lot of emails from Australia too, which I always really enjoy. I enjoy them from everywhere though, so keep writing. Anyway, so in Australia, the numbers are between 2 and 6%, again, with the majority being women diagnosed. So again, very similar numbers. Great Britain, the numbers were also similar. They came in around 4.4%. And again, the majority of those being diagnosed are women. There's all kinds of things we can say about that. We do know though that it's not that more women necessarily, like I said, get it. It's that there are more women diagnosed. So I could do a whole podcast on why I think that's true, but I'm not going to. Again, beyond the fact that men are misdiagnosed. But anyway, okay. So let's talk about symptoms of borderline personality disorder. That's why you paid to be here today, right? You're like, what are the symptoms, Abby? Tell me what they are. So there are a few specific kind of characteristics of people with BPD. Now, I do want to just say someone is likely not going to have all of these, but they're going to have at least, 3 probably if they're in this official diagnosis. And I'm not diagnosing officially or doing any of that right now. I am telling you, we're doing this just me and you. Okay. So the first one, not hard to guess, is that there's this intense relationships. There's a lot of intense relationship with lots of conflict, lots of instability that, by the way, they often seem to create, they'll get themselves into situations that create the instability or the rockiness or the craziness. They'll, insert themselves where they don't belong. They'll, it just seems like things are always happening to them. That's kind of what happens in their lives. They end up with so-and-so tried to cheat me and this person was this. And it's always seems to be happening to them. They definitely, one of the big things we see is that they view things in extremes. So it's all good or all bad. You're all good or all bad. They can go from loving you to hating you in 5 seconds, very quickly. The other thing we see a lot with BPD is self-harm. Cutting, suicide attempts, suicide threats. There's a lot of that kind of talk and stuff going on often. So when I'm doing when I'm doing a background on someone and I'm, listening to their history, I can often tell right away when there's this history of, again, kind of self-harm attempts, some cutting or suicide attempts or lots of threats or lots of in and out, coupled with a lot of just kind of, there's always just a crazy background, for lack of better, and I say that with so much love in my heart. There's just so much stuff. There's so many intense things that have happened to them, around them, with them. And it often, starts my spidey senses lighting up. Okay. Another symptom is an intense fear of abandonment. And so, I mean intense. Everybody on some level has a fear of abandonment, but with BPD, it's really strong, and so because of that, no one can ever do enough for them. So we see that a lot, no matter what you do for this person, it's never enough. They want more. This is also the kind of person who will get into a relationship like deep really quickly because, again, they have this intense fear of abandonment. So they'll try to kind of get right in there and get hooked in very, very quickly. Another symptom we see a lot with BPD is that there are major changes in their self-identity, in their self-image, all the time. Like, so how that might look is that they might have really, their goals are always shifting. What they say they want to do for a living is always shifting. What they, how they talk about what's important to them one day could be very different than the next. Their values can change seemingly overnight. Their self-image will get damaged. Sometimes they'll see themselves as really just kind of horrible humans or invisible humans. So this is the way that shows up. Another symptom is very impulsive or risky behavior. So you might see, drug and alcohol abuse, eating disorders, gambling, unsafe sex, spending sprees, right? Now, I do want to say, and this is the reason you're not supposed to diagnose anyone. Sometimes people can have those things during times of, like, I might, or not me, but somebody might do too many drugs or drink too much when they're really, really happy. They're just having this elevated mood or all this energy, and they're out spending money or having sex or doing these things. And that can often be a symptom of a mood disorder like bipolar, and not borderline personality disorder. So this is why we in the field call this a differential diagnosis, when we're, again, a lot of these things can seem very similar. And so our job as professionals is yes, we look at these lists and we understand, we open our DSM and we see what the criteria are, but we also have a sense after so many years of doing things. Like I said earlier, if I start to see certain things in an intake, as I'm assessing someone, my wheels are churning in the back, and I'm starting to already differentially diagnose. I'm already starting to go, I wonder if this is this or this. Now I'm going to ask about that to try to rule things out or rule things in. So it's not as easy as looking at a list and saying, the person fits all these, because I got to tell you, at any given time, a person can look depressed, or they couldn't be, or it might not be depression. It might be alcoholism, or it might not be alcoholism. It might be bipolar disorder, or it might not be bipolar disorder. You know what I'm saying? Like, at any given time, it can look like different things. And that is, again, why I implore you not to use your Google degree and instead to get people professionally assessed. Okay. Another thing I see with BPD that we see a lot is ending things impulsively. So this person might leave a great job or even a happy relationship, like overnight, like very impulsively. Mood swings are another one, often lasting from a few hours to a few days. So that could be, but the mood swings could be, rage and lashing out, intense happiness, really low feelings of, shame or anxiety. Like, so it can go all over the map. Another thing we see are sometimes feelings of disassociation, like someone feeling cut off from their body or their feelings, having this sense of unreality, okay? Those are the biggies, and I'm just going to throw in a few others that I commonly see with this diagnosis. As I mentioned earlier, like this history of suicide attempts, threats, or cutting, or just hospitalizations. But I often see lots of job changes, getting fired or laid off a lot. And you might say, well, people can't help getting laid off, but again, it just seems to follow these folks. Starting but not completing things like a degree, or again, like an interest in a kind of job, and you start it and then all of a sudden it's something else. Projects around the house that are never completed. Again, someone might have ADHD and that's why they never complete jobs around the house. So again, it could be a lot of things, but when we see a lot of the things I'm mentioning together, clustered, then we start to think. And again, like I said, these conflict-filled relationships, just a lot of chaos in their life. Sometimes like abortions, unplanned pregnancies, accidents, fights, STDs or STIs, we now call them, sexually transmitted infections, right? Chronic pain, all these physical issues, you'll see just thing after thing. And yeah, it's like real, I've had clients with BPD who really did have cancer, who really did have, other physical things, but it's just thing after thing after thing. It's as soon as one thing gets cleared up, it's another. It's just, it's incredible. Like, so it's not that they're not real, like I said, it's just that somehow these people get a lot of it. So the next natural question always to have is, okay, well, what causes borderline personality disorder, right? What causes BPD? And I'll tell you that we don't know exactly what causes any personality disorder, but we do know that there's kind of three contributing main factors. And one is your genetics. You're at a higher risk of any mental disorder if someone in your family has had it. Any mental disorder. That's why one of the first questions we ask if you come in and let's say we diagnose depression, one of the first things we ask, or if we're not sure if you have it, is that's the first thing I'm asking, like, oh, do you have a family member with this? Or does anybody have alcoholism? Or is it, I'm always looking at the family because it's one of the indicators. It's usually in the line. And sometimes you will see maybe even like, let's say drug addiction or something in your generation, and you don't see any in your parents, but you do, as I'm talking to someone, they'll say, oh yeah, well, my dad was always depressed at home, or my mom was super anxious. It shows up in different ways sometimes. And then, the symptoms can change where the underlying thing is this anxiety or depression. Okay. The second thing are environmental factors. So, of course, just any kind of really super stressful childhood, childhood abuse, neglect, all of them are associated with BPD. And as I always mention when I talk about trauma or anything, this can be anything from being separated from a parent when you were young. Maybe your parents divorced when you were young and one of your parents moved away and you didn't see them very often after that. Obviously, to something really clear like sexual abuse, but you could have also had a caregiver who did drugs or was a drug addict or had mental health issues or chronic, some chronic debilitating disease. I went with a client recently whose dad had terminal cancer for years, like was in it, almost died, I don't know how many times. And, that is traumatic to live with. So you can imagine. Okay. And the third thing is our brain abnormalities. Research has definitely shown changes in certain areas of the brain that are involved in emotional regulation, impulsivity, aggression, and there's been evidence of neurotransmitters not functioning properly. So now the problem with these kind of studies is that because you can't tell if those differences, these changes in the brain were risk factors that were already there, right? Like you were born with them and then developed BPD, or if these brain changes were caused by having BPD. We just know that they are connected. Does that make sense? So, because, you can't, like, I get diagnosed at 30 with BPD. I don't have a brain scan of when I was born, usually. So you can't tell when those changes happen. But we do know that people with BPD, when their brain scans are compared to people without, we do see these changes. So we do know that. Okay. Now, so how does BPD show up in relationships? That's right. That's why you're listening, probably. And people with BPD tend to view the world in this sort of black and white, all or nothing thinking. So, and when they do this, they really easily misinterpret, misunderstand the words, the feelings, the actions, the motivations of other people. They don't get it. It's like they're not really understanding what's happening around them. So, and because they're seeing the world in this way, they have these very intense emotional reactions. And remember, what do I always say? We feel the way we think, right? We feel the way we think. So then because of that, they're thinking these kind of thoughts that aren't really correct. They then have a hard time regulating the feelings that come out because the thoughts are so over the top. So, and then the more they can't regulate how they're feeling, the more upset they become. And that often leads to what I see is very just self-destructive and impulsive behaviors, right? You can imagine. And they end up, really what happens, which is the heartbreak, I think, is that this kind of skewed thinking actually becomes a self-fulfilling prophecy. And I'm going to give you an example of a gentleman I worked with about a year ago, maybe a little more now. Time flies. But I was working with this gentleman, and his wife had BPD, and he'd been coming to me for a little while. He was trying to deal with her, and she just was, they'd been, I think they'd been married. It was a second marriage for both of them. They had kind of fallen in love in a whirlwind romance. They got married very quickly. They were in their early 50s. He was in his early 50s. I think she might have been late 40s. And he didn't see a lot of this stuff right away, right? And it showed up, and it just seemed in the beginning like there was all this sort of intense, passionate, wondrous things going on, and then it kind of shifted when you get to living with someone. And so he was coming to me for a while, and during that, he started to have heart palpitations. He started to have these symptoms, like he would get some tachycardia, he would have some sweating, he felt like his blood sugar would drop. Anyway, it was making him really anxious, as you might imagine, and he and I were talking, and it wasn't related to her BPD. He's a 50-something-year-old man who was smoking and a little overweight, and he was having some health issues. So he was going to the doctor and getting tests and things, and he was talking to me, and he told me, he said, I'm not telling her about this because she'll freak out. Whenever anything is going on, she overreacts, she gets so upset, and I have enough to deal with right now, so I'm just going to deal with this on my own. But what was happening, and he and I were talking about it, because I was telling him I didn't think he should do that. I said, she's going to pick up on, and she was picking up on, he was distracted, as you might imagine, right? You're not sure what's going on with your health. You don't feel good. You're worried. And he was getting some stuff that he might have had a blocked valve. And anyway, he was getting all that checked out. And she was getting very upset because he was acting distant and he was being a little quiet with her. So of course she noticed it, and she started to spin. And she was going crazy. She started accusing him of cheating, right? Because she, again, the BPD, she was going like way over there. Quiet and a little disconnected. A little distance means you're cheating on me. And she accused him. And so at this point, right, he told her the truth. I was begging him. I was like, you got to tell her. You just have to tell her. So he does finally tell her, hey, it's actually this heart thing. I've been going to the doctor. But she doesn't believe him. She thinks he's lying to cover up the cheating. At this point, she's already been going crazy, right? And over the next few months, and he was okay, by the way, he got it checked. He had to change his diet and do some stuff, and he had to get on some medication and stuff. But he was okay. But over the next few months, she started going crazier and crazier with the cheating thing. She had him followed. She asked friends to follow him. He figured this out later. She was breaking into his phone, his email accounts. She was stalking his social media. I mean, there was a bunch of stuff. And he kept confronting her about it, and she just kept spinning. So what happened was he got so sick of her behavior that he did, in fact, finally choose to leave. He couldn't handle it. So she created this self-fulfilling prophecy. She was so afraid of him leaving, right? She was so jealous of other people, even though there was nobody there. Trust me, I was doing therapy with him. There was nobody else there. And she created all this craziness so that he actually finally left. And then, of course, she says, see, I was right. And she wasn't right. This kind of stuff I see a lot with someone with BPD, this kind of way that their life seems to follow the things they believe, but it's really because of how they're acting in their life that's creating a lot of it. So how can you help someone struggling with BPD? What can you do? If you find yourself, if this is your partner, or if this is your brother or your mom or someone in your life, you're like, okay, what do I do, Abby? It's really nice. I understand it now. I understand where it comes from. I see the crazy. They match all these things you're talking about. What can I do? And I will tell you that first and foremost, there's very little you can do on your own to help someone struggling with BPD. Your best bet is to figure out a way to get them to a professional trained in helping someone with BPD. So, for example, it's not my specialty. I've worked with people with BPD before, but generally usually I can screen out people that have that, and I send them to someone else who'd be better suited to deal with them. The way my practice is set up, the way I set up doing things, that's not for me. This is someone who would be emailing me a lot or calling me a lot or texting me a lot, and it's just not the kind of clients I have anymore. It's not the kind of work I do anymore. I don't deal with people in crisis anymore. Not that kind of crisis anyway. So I'm not specialized in the kind of training that is best to actually help them. So you really do want to make sure that you get somebody who is trained and effective. And I will tell you that there's one main type of therapy that's been proven effective for borderline personality disorder, and that's something called dialectical behavioral therapy, or DBT. So I apologize for all of the initials today, right? BPD, DBT, LMNOP, you're going to hear them all. But DBT, or dialectical behavioral therapy, it was in fact specifically developed to treat people with borderline personality disorder. So I'm going to tell you a little bit about DBT right now. It was developed in the 70s by she was an American psychologist, I'm 99% sure. Marcia, I think it's Linehan, I want to say. Linehan. I'll do it correctly on my blog, so I apologize. But DBT it's a type of talk therapy, basically, and it's based on cognitive behavioral therapy, CBT, which you've heard about a lot. CBT is pretty much what all therapy is based on, which it just helps people understand how their thoughts affect their feelings and subsequent actions, right? Because you feel the way you think. So if you can change what you're thinking, you can change what you're feeling, and you can have a different life, right? I talk about CBT stuff all the times. It's really about reframing what you're thinking in a new light so you can feel differently, right? About whatever the thing is. Okay. So Marcia took CBT and amped it up and really made this incredible, and it's been expounded over the years in research now, and it's really, DBT is really a special form of therapy. It's wonderful. It's wonderful for more things than just borderline. I do want to say that, but anyway. So dialectical means combining opposite ideas. So dialectical behavioral therapy is this idea of combining opposite ideas, meaning it focuses on helping people accept their reality while seeing that reality in a new light. Does that make sense, right? This is kind of the opposites coming together. So this is your reality, but you don't have to see it the way you've been seeing it. You can see it in this other way, and that way you can change, you can create change, and you can better regulate these unhealthy emotions and impulses. So the way DBT is done, it's basically a skills training, and sometimes it's usually done in groups, actually, or the places I refer to here in the Bay Area, it's like a place, where I refer, and there's therapists there, there's groups, they do individual work, the group work, where they learn the skills. But again, individual therapists can be trained to work with people individually too. So you don't have to go to an agency or a clinic to get DBT. You can, but again, you need someone who is trained in it, not just someone who says they read a book, but someone who's trained in it. I'm not. So I could tell you all the stuff and I could, go over it like I am today, but you wouldn't send the person to me. That's what I'm trying to say. It's not just about being a great therapist or someone who's really talented. It's about someone who knows this. Just like if you had cancer, you wouldn't go to your primary care physician. You'd go to an oncologist. You'd go to a specialist. And we should treat mental health the same way. You should be going to specialists when there's a need for that. So this training in DBT is focused on 4 main skills. One of them I talk about all the friggin' time, which is mindfulness. It is. So the first skill people learn is mindfulness. So it's, staying fully aware, focused in the present moment, not worrying about the past or being anxious about the future, right? The second skill they learn is distress tolerance, meaning they learn how to manage and understand the emotions that crop up when you're in a stressful situation. They learn how to tolerate stress. That's what they're learning. And, you tolerate the stress without responding with some kind of harmful or unhealthy behavior. The third skill they learn is interpersonal effectiveness, right? Understanding how to ask for what you need, how to set boundaries, how to, being respectful of yourself and others. And then the fourth thing that they learn is emotional regulation, which is really understanding their emotions, being aware that they're having an emotion, and then obviously kind of control over the emotions or being able to regulate them. So these 4 skills are taught sometimes over like a 3-month course, sometimes in, different kinds of ways. And it's incredibly effective. I kind of think as DBT is sort of almost like a spiritual cognitive behavioral therapy mixed with, again, these very specific skills. And when I talk about those skills, you can probably think of a lot of people who could benefit from DBT and learning those skills. And that's why I say it's not just, even though it was created for BPD, it's not just for people with BPD. It's for really people who are having trouble regulating emotions. And so it's being more widely used now and across more problems, which is wonderful because, again, it's an evidence-based model. So it's kind of wonderful. All right. But there are some things you can do on your own to help. There are. And as I said, getting professional help is top of the list when it comes to really truly helping in the long term someone with BPD and creating changes. But there's a couple things you can do to even just help that along, to help the person get professional help. And first and foremost is to have strong, clear, consistent boundaries. A person with BPD is often all over the place. So it's important that you're not reacting to them. Some days they'll praise you. The next they lash out in anger. Your job is to make sure that, that the tail doesn't wag the dog. That is the best way to say that. That's what happens a lot. You should be leading, not following in this relationship. You should be the one. What happens a lot is the BPD person is so there's so much going on. There's so much craziness in different ways that you're always reacting to that. And that can't be, because now we're letting the person who has sort of a fear-based mindset lead the team. No. It needs to be you. So whether this is at work, whether this is with a family member, your mom, your partner, it doesn't matter. You want to be thinking, what are my boundaries? What do I tolerate or not tolerate? How do I act in the world? So no matter how they act, you're the steady ship with clear and consistent responses to any unhealthy behavior you see in them. So this could be that if they're always threatening suicide, if someone's threatening suicide, your response needs to be, next time you threaten suicide, I'm going to call 911. End of. I'm just telling you what I'm going to do. Because a lot of times there's some emotional blackmail there. They'll say, well, if you don't do this, then I'm just going to kill myself, or I'm going to never speak to you again, or I'm going to whatever. And they're doing that to, manipulate you into acting a certain way. And you need to get out of the emotional blackmail. And if they're saying they're going to kill themselves, I would take that as a credible threat, and I would immediately call 911. End of. You don't have to diagnose them. You don't have to stop them from doing it. They might run out of the house, and you can say, that's fine, you can run, but I'm going to send the police after you, and we're going to find you, and you're going to end up in a 5150 in a ward. That's what's going to happen. Because, and I can't say that they would never hurt themselves, but it's not my experience usually that BPD people actually, I don't, the 2 suicides I've had in my career were not people with BPD. They were people with very severe depression. Suicide is rare. It's scary and terrifying when people are threatening it or threatening they're going to cut themselves or whatever else. But again, you're not equipped to handle it. You need to call a professional. So you need to let them know. That's a clear and consistent boundary. You don't have to get upset. You don't have to yell and scream about it, but you can tell them. If they lash out at you, you can, again, have a boundary. I told you last time that the next time you lashed out at me like this, I was going to leave the room, so I'm leaving. But then you have to follow through. What do I always say about boundaries, right? Boundaries are just a wish unless you actually follow through on what you say you're going to do. This is about you, not them. This is about you, and it's about containment. Whenever we have every rehab, for example, I've ever worked in, there's always going to be a borderline person coming in. It always happens. They come in and they get very disruptive to the community unless you really work on containing them. So the rules, you follow the rules, you don't give in, you don't give an inch, you don't give an inch. It's containment, containment, containment. It's a consistent boundary. Without yelling, without screaming, without frustration, without rolling your eyes. It is like, this is what's going to happen. If you do that, I understand, but then I'm going to do this. That's how it is. Or I'm doing this and you can come along or not. Like, but this is what I'm doing. I'm going to do this thing, or I'm having this, or I'm going this place. And, if you'd like to come, that's great. If you don't want to, I understand. And then that's it. And then you just go. Stop talking. So it's all about you not saying what you're going to do or what's going to happen. It's about doing it. It's about following through. There is nothing more effective than you having clear and consistent boundaries. And that is the time that I've seen people with BPD finally go to therapy or finally be willing to do something, when the people around them, it just have such a clear boundary that the person almost has no choice if they want to, keep existing in that orbit with you. They end up finally doing something. I've had people at work with, a coworker who has BPD. And again, just staying clear. And that person with BPD usually quits. They usually quit anyway. So it's, don't let them ruin your life while they're there. Again, we don't want to do it with anger. We don't want to do it with fury or F you or anything else. We just want to do it from that loving, clear place. So boundaries. Consistency is what it's about. The second thing you can do is learn about BPD, as well as the basics of this dialectical behavioral therapy I told you about. If a person you loved had cancer, you'd likely learn all you could and understand the treatments offered, everything you could know about the kind of cancer they have, so you could converse knowingly with them, so you could support them in their decision making, so you could, really be a part of the solution. So the same strategy should apply for mental illness, not just physical illness. It's the same thing, but I'm always amazed at how little people will learn about drug addiction or alcoholism or depression or anxiety or borderline or whatever else it is. I'm amazed at how little people will learn about it who are in a relationship in some way with someone who has it. It is because we discount mental illness. We think people are doing it to themselves, certainly with drug and alcohol, and no one made them drink, that kind of crap. It's a disease. We know that. My gosh, I did a whole episode about it. It's real. These things are real. They are real chemical. We know BPD is real chemical changes in the brain. It's not made up. So treat it like real changes. It's truly an illness. So as you would with a physical illness, I also don't think you'd yell at someone who had cancer and came out of remission, like, oh, I can't do this again with you. I just can't. I can't go through this again. I don't think you would do that. Same with if someone is more solid and stable in their BPD diagnosis, but has a relapse of some sort or has some sort of crazy way they go or something happens, I would expect you to not throw up your hands and say, that's it, I'm too tired of this. Instead, to go back, to draw your boundaries, to have clarity. But it doesn't mean you have to cut them out of your life. It doesn't mean that you have to just, write them off or be mad at them. There are other ways to handle this. And the last way you can help the most, which I already stated earlier, is to get support and counseling for yourself. The stronger you are and the more able you are to be supportive while holding these consistent boundaries is absolutely positively the better off that they will be, that these people will be, right? Without a doubt. So that is it. We have covered in huge detail BPD, borderline personality disorder, what it's about, what it really is, where it comes from, what you can do, what treatment really helps. And I will, as a last note, just say that medication is not something that we normally have for BPD, really, because it's a personality disorder, not a mood disorder. So that's, but there are, depending on what other constellation of symptoms this person might have, medication could be effective in some ways for it, but it's not really the first line of defense. So, but again, a professional person should be making those decisions with you and your loved one and all those people together. Okay. Woo! That was a lot. We went down the road. We were deep. We were together. So again, a reminder that in a couple weeks when I'm not here with you, I'm here with love. It's a great time to go through the back catalog on my website. Go to my website, go hang out. There's so much there. There's so many free things. There's always notes. Like if you just listen to all this and you're thinking, oh my God, I can't remember all that, on the website right now, under relationship tips and tools, that's where my blog is. There's a blog post about this with everything written down, with the links, with all the goods. So it's just such an easy way to do all that. And again, if you're watching this on YouTube, go back through my old YouTube videos. Go way back. I used to do very different videos before I started videoing the podcast about a year ago. I used to do other kinds of topics and talk about them, and they were much shorter videos, but there's a ton of them. And so they're all about 15 minutes or less. It might be really fun to do that, in the couple weeks that I'm gone. And, still have your little dose of Abby. And I could have my little dose of you, which would make me happy. All right, that's it. I hope you have an amazing week. I just love and adore you. I'm always so touched that you're here with me. I'm so happy that you write in, let me know what's working and what's not, and how I can help you best. So have a great week. Be kind to yourself and others, and I'll talk to you real soon.